Hello and welcome to the 11th episode for Fig Friday. This is crazy. Time is flying this year. My name is Sharon Durnick and I'm a broker here at Frontline Insurance Group LLC. So we had some questions come in that I wanted to go over. Just in case you're ever afraid of posting a question or worried about getting calls from agents or something like that after you're done talking to a broker. In most cases, that is not like that here. We don't keep continuing to call out only unless you want us to give you a follow-up call. So let's get into some questions. So the first question I had is, what is the penalty for Part B if you don't take it right away? Incredible question. That is a penalty that'll be on for the rest of your life. So it's very important that you do know this answer. So if you have credible healthcare coverage, meaning another plan or group benefits from your employer that you want to just maintain and not go on completely on Medicare, you have that right to do that. You will not have a penalty for not adding your Part B if you have other coverage. So now they will assess you. Don't get me wrong, Medicare will assess you for one. But as long as you can show proof later on that you did have coverage at that time when you declined to have your Part B, then they'll just remove the penalty from your profile. So you want to make sure that you either keep, save, give to your insurance agent all your coverages from the point that you turn 65 that you did not take your Medicare. Make sure you give that coverage or a copy of the coverage to your agent or keep it in a file because they will ask for proof later on down the road to remove that penalty. Okay. All right, second question. Does Medicare supplements cover me when I travel? Yes. They go with you no matter where you're at in the country. As long as the doctor or facility takes that Medicare for payment, then your Med Sup will pick up with no questions asked. Okay. Now, also, I do want to remind you, if the doctor's door or the facility has like a billboard that says, for example, we don't take Cigna, that's not the Medicare supplement that they're talking about. That's private or group coverage. So no matter if you have Cigna, Aetna, Humana, United Healthcare for your supplement, they will take it because it's a supplement to Medicare. Medicare is going to be your primary, your supplement, your secondary. So if the sign says I don't take Cigna, they're just referring to group coverage or individual plans. Okay. All right. Number 3. If I have diabetes, can I get a Med Sup added on down the road when I'm not in my initial coverage period? Yes. And this is a very good question as well. So as long as you meet the underwriting guidelines, meaning you're going to have to answer some medical questions that the agent is going to ask you before the coverage. One question that they do ask is if you take more than 40 units of insulin daily. Or if you do have a heart condition along with diabetes or any other condition other than just diabetes. So as long as you don't get medically declined, you can get that coverage for whatever you need when it comes to Medicare supplements. If they feel that something in your profile, medications that you've taken in the past, or something that won't make you decline, but they can adjust the premium to have a different level, they will give you that at maybe a higher premium. But in most cases, just the diagnosis of diabetes is not concerning at all. All right. Fourth question that came up. Can I get dental started right away? Yes, I actually have a company and I love them. They're the Emeritus company, or Emeritus is what some people call it. That's one of my carriers. And they start coverage the first day you make your premium payment. So I can start your policy within 24 hours. As long as you make your payment within 24 hours, your coverage will start that in 24 hours. So the next day. Okay. What happens, number 5, what happens if I make a mistake and get into the wrong insurance? This is a question that I'm asked a lot, almost every single call. And this is my answer. Nothing is ever set in stone. There are different ways, time frames that you can adjust your coverage. If you can wait, that would be best because then you don't have to jump through hurdles, calling the insurance carrier, trying to get it adjusted that way. Now, if any other agent has misled you, meaning they told you something that was in the policy that actually isn't, and you need that coverage, that is misleading. You can actually call Medicare and file a formal complaint. So we're going to talk more in the upcoming videos about formal complaints that you can file and what all is involved in that. Now, keep those questions coming. I love answering all these questions. It means that you guys are really concerned about your healthcare coverage going forward, making sure you do have the right benefits you can have and that you want. So if you do have any other questions, please feel free to comment at any time. That's the fastest way of getting your question answered. If you'd like to share, follow, and like this video, that's going to help anyone out there that either needs coverage or would like to save some money. So please make an effort to share or like our videos. Now, you can go on our website to schedule an appointment or to ask a question with our QR code that is right here, and that goes directly to the website. All you got to do is scroll completely down on the website, and you can actually post a comment or ask for an appointment to be scheduled. Also, I do have our phone number listed right here, and I'm at pound extension 800 is my direct line for all the brokers that are here, or anybody that answers will answer all your questions as well. All right. So the next episode will be coming up next week. Bye for now and have a wonderful week.